Hi, I'm Dr. Albert Ho with Bluefish Pediatrics, and I'll be talking about milk protein intolerance. Milk protein intolerance is a condition that usually affects about 1 to 2% of young infants and is caused by an immune response in the gut to certain kinds of proteins. Most commonly, the proteins found in milk products, but can sometimes involve the proteins also found in soy and egg products as well. These babies usually present in the first 1 to 2 months of life, and the condition usually resolves by the time the baby is 9 to 12 months old. These babies usually present with blood or mucus in their stool, though sometimes the blood can be microscopic and can only be seen when we test the stool for blood. Sometimes these babies can be really fussy as well. Otherwise, these babies tend to be healthy. They're feeding well, they're growing well, they develop normally, and their physical exams are normal as well. The diagnosis is made based on having these typical symptoms and excluding other diagnoses. Features that are not commonly seen are poor feeding, poor weight gain, excessive or projectile vomiting, dehydration, or lethargy. And the presence of these features should prompt the consideration of other conditions. Since this is a condition related to the milk proteins in their diet, the treatment is to try to remove these proteins from their diet. If your baby is breastfeeding, your pediatrician may recommend that the mother undergo an elimination diet where she removes the proteins, the milk products from her own diet. This may involve removing milk, milk-based creamers, yogurts, cheeses, ice cream, and other products as well. Once a mother has changed her diet, the proteins will no longer be present in her breast milk and therefore can no longer be passed on to the baby either. If your baby is formula fed or needs formula supplementation, your pediatrician may recommend a hydrolyzed formula, also known as a hypoallergenic formula. Nutramigen and Alimentum are common examples of hydrolyzed formulas that can be found at most grocery stores. What this does, it takes the proteins and chops them up into smaller pieces so that the body doesn't recognize it as much. Once your baby's diet has changed, the symptoms usually resolve in about 1 to 2 weeks, and then your baby will remain on this restricted diet until they're about 6 to 12 months of age, at which time your pediatrician may recommend to reintroduce these milk proteins into their diet. Milk protein intolerance is diagnosed as almost exclusive of young infants, and almost all babies outgrow it. This should not be confused with lactose intolerance or anaphylaxis allergy. In lactose intolerance, the individual has the inability to digest and absorb certain kind of sugars, so not related to the proteins. And an anaphylactic allergy is a severe allergic reaction that presents with sudden onset of hives, wheezings, difficulty breathing, and possibly other symptoms as well. So milk protein intolerance is a condition of young babies where they have problems with the proteins inside milk. So the treatment is for the mother to undergo an elimination diet or for the baby to drink a hydrolyzed formula. These babies tend to do very well. Once their diet changes, they're happy, they're growing well, they're feeding well, they develop normally, and they have no restrictions in their diet later on. And it is very unlikely to lead to problems later in life.